We'll go ahead and we'll get started. So today we're going to talk about a topic circling around braces. So a lot of times I get this question a lot on should I be considering, so like if people are having knee pain or low back pain, a lot of people are thinking about using braces, or they've had their doctor or another practitioner tell them that they should consider wearing a brace. And so are braces good or bad? And so I want to address that topic today and kind of explain when you should consider it, when you shouldn't, and kind of give you the lowdown on that. So I wanted to, this isn't going to be based on my opinion. This is everything that I speak about is based on what does the most current research advise and show that is most beneficial. So I want to show you guys what is out there and what the research is telling us regarding this topic. So first of all, do back braces. And so if you're having knee pain or back pain, is there a place for knee braces? Yes, absolutely. However, based on the research, it shows that back braces and knee braces don't help quite as much as what we once thought. So the research shows that most of the pain relief that people get is actually placebo. Okay, and there's not actually a whole lot that is going on with the braces that are providing pain relief. However, there is some research out there that shows that there is some positive effects with it. And so you guys are probably wondering, well, when should I use them and when shouldn't I then? There's a time and place. So the best time to use braces, if you're going to use them, is usually at the beginning or the early stages of the injury. And I'm going to kind of backtrack a little bit too. There's different types of braces on top of that as well. So like if you get post-op, if you're post-op or post-operation for a knee pain or a knee injury or back injury, that's a different type of thing. You should definitely be using the braces, but you need to be weaning yourself off of that, and you don't want to become reliant on it. The situation I'm going to be talking about the most today is with regards to people that may have gone on a run and started having knee pain, or they were deadlifting or squatting, or went to pick something up and threw out their back or started having back pain. That's kind of the topic I'm going to kind of focus on today because that's the type of question that and situation that most people have questions on. So in that situation, if you were on a run or you bent over, picked something up incorrectly, or doing squats or deadlifts, should you be wearing a brace? Most of the time, no. And I'm going to kind of explain why. You can use at the beginning stages, if you're at the part of where you can hardly move and you throw a brace on there and it helps significantly and it allows you to move, then it's okay. But because movement is medicine, okay? And so if that brace allows you to move, that's fine. But we want to start weaning you off of that as soon as possible. Why is that? Well, what the braces do is they essentially just replace and start producing stability that the muscles are supposed to be doing. In the acute phase or the early phases of an injury, a lot of times we're in quite a bit of pain. And when a muscle or an area is experiencing a lot of pain, what will happen is that muscle will kind of just turn off a little bit and not work like it's supposed to. Okay, but over time it will. It's just injured and irritated, and so that brace can provide the stability that the muscle is not. Another thing that causes these injuries is weakness. Okay, and that's why a lot of times when somebody uses a brace and they get relief, that's actually a really good sign because it means that we just need to strengthen up the muscles to do what the brace is supposed to be doing. Okay. And that's totally possible. The only time it's not possible is if somebody has like a neurological condition, like they had a stroke or a brain injury or a spinal cord injury, or something neurologically wrong. That's when they usually have a hard time recruiting muscles. But if you don't have a neurological condition, there's no reason that that muscle cannot get stronger and provide the support that it's supposed to and the support that the brace is providing. Okay. So also another problem with braces is like I said, they're providing the support that the muscle is supposed to be doing. Okay. And so what it does is when that brace provides that support, now the muscle doesn't have to work whatsoever, okay, or significantly reduced. And so what happens is if you don't use it, you lose it. And so that muscle that was already weak becomes even weaker because it's not that brace is doing all the work for it. So a lot of times braces in the long run can actually be more problematic and lead to further issues and just enhance that issue in the long run too. They're okay for a couple days or maybe a week or two, but then you need to start working your way off of that and getting the muscle to do what it's supposed to be doing. Okay. So another thing is it's not really treating the root issue. It's really just kind of treating the symptoms and kind of like a band-aid. It's really not fixing anything. Okay. And so if you really want long-term relief, then you need to get to the root issue of it. Okay. And that's what we focus on at Pro+Kinetix Physical Therapy and Performance, is getting to the root issue of this. Okay. Because we don't want, a lot of times braces people become reliant on the braces, and it turns into like somebody just using it when they run. Okay. And then it turns into, oh, now I'm really having pain with just walking, and now I need to use a brace for walking. Okay. And then it turns into anytime somebody wants to move or walk around, now they have to use the brace because they become reliant on it. And it makes the issue even worse in the long run because the muscles aren't working like they're supposed to, because the knee brace or the back brace is providing that support as well. Okay. So I want to kind of share a story with you guys of a patient that saw us that was in this exact situation. So she was a runner. She was 26 years old, and she went and saw her physician and was looking for answers on what was going on. So she had meniscus, slight meniscus tear. The meniscus is kind of like cushioning in the knee. It was a small tear. It wasn't anything crazy. And then she also had a lot of tightness around the knee joint, and then also some weakness in the hip. And her running mechanics were off a little bit too. Anyways, she went and saw her physician, and her physician's like, all right, so all you need to do is I'm going to give you this brace, use this brace, and see how it goes. If this doesn't work, then we'll just try an injection and see if that helps as well. And then props to this patient. She's like, well, what about like doing physical therapy or strengthening or something like that? What should I be doing with that? Like, physician's like, no, you're good to go. Just go home and do some hip strength exercises, and you'll be fine. And and this is a story I hear all the time. I don't understand why physicians are just, I don't like to bash physicians, but so many times, and again, they're in a rush. They're only got 5 to 10 minutes with you just because of the system. The system's broken, in my opinion. Long story short, they only have 5 to 10 minutes with you. They don't have a whole lot of time to really assess the issue and get to the root problem of it. So I hear this a lot. And so because they have limited time, they just tell you, okay, try and brace. And if that doesn't work, then we'll do injections, or try this injection. If this doesn't work, we'll do medications and surgery or whatever. And so props to this patient. She went out of her way and didn't take, she's like, this doesn't sound right to me. There's got to be something. I'm 26. Why I shouldn't be relying on a knee brace or anything like that. I don't want to be doing injections. I'm 26. What am I going to be like when I'm 50? And so she's like, I want to be active. I want to be active for the rest of my life, and I don't want to have to be relying on using a brace or injections or any of these invasive problems. And so she searched physical therapy in Oakland on Google, and she found us. And so she came in for an assessment. And what happened is it was a very straightforward issue. She had some tightness in her quad that was throwing off the mechanics of the knee, and that kneecap wasn't tracking the way it's supposed to, and she was getting irritation underneath that kneecap. And she did have a knee brace, and she's like, it was a really expensive knee brace. It was like hundreds of dollars. And she's like, it helps a little bit when I run, but it really doesn't help immensely. But anyways, she's like, I can walk and without pain if I'm wearing the brace. And she hadn't even tried running. And within 2 weeks, we had her off that brace, not having pain with walking. And on that third week, we progressed into running. And her big goal was she wanted to run a half marathon. And I think it was like 3 or 4 months down the road. And she did it. She did it pain free. She didn't need the brace. She didn't have any pain whatsoever. She solved the root issue, and she's still not having pain today. And that was over a year ago. So that tells me that the root issue was solved. And she got done, and she's like, I can't imagine where I would be at is if I just took that advice of my physician and just tried going with the knee brace. I'd probably still be in that knee brace, and I probably wouldn't be running like I want to too. She's like, I can't imagine if I wouldn't have, took it in my own hands and found you guys. And I share this story because a lot of you guys may have experienced have the same exact experience or story, because I hear it all the time. And so I want you guys to know it's totally possible. There's no reason to be reliant on a knee brace or a back brace or anything like that. The big thing is it is not treating the root issue. Okay, guys. So There is a way. We just need to get the muscles to do what they're supposed to. Strengthen up the muscles that are weak, loosen up the muscles that are tight, and really get to the root problem of it. And then you don't need to be relying on an annoying brace. I mean, personally, I can't imagine, anytime I wanted to go on a run, or anytime I wanted to go do a squat, or anytime I want to do a deadlift, I have to put on a stupid brace every time, or just to walk, I have to throw on a brace on. That's annoying, and there's no reason for that in the long run. Okay, so there's a solution. Find the root cause of it. Find somebody that can help you, and go from there. So, bottom line, there's no need for knee braces or back braces in the long run. So, if you guys, hopefully this was beneficial. If you guys have any questions, just let me know. All right, thanks, guys.